This episode is brought to you by Progressive Insurance. Do you ever think about switching insurance companies to see if you could save some cash? Progressive makes it easy to see if you could save when you bundle your home and auto policies. Try it at Progressive.com. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary. Not available in all states.
Beautiful Anonymous changes each week. It defies genres and expectations. For example, our most recent episode, I talked to a woman who survived a murder attempt by her own son. But just the week before that, we just talked the whole time about Star Trek. We've had other recent episodes about sexting in languages that are not your first language, or what it's like to get weight loss surgery. It's unpredictable, it's real, it's honest, it's raw. Get Beautiful Anonymous wherever you listen to podcasts.
Hey there, and welcome to the Think Fitness Life podcast. We're fueled by the incredible clients who inspire us every day, allowing us to elevate their health and fitness journeys. On this show, you'll gain valuable insights from top professionals, hear inspiring transformation stories, and discover the knowledge and motivation to create your own best life. Let's dive in. As someone who has continuously used therapy as a way to heal and elevate my personal performance, I know wholeheartedly that you cannot always read the label when you're in the jar. And that's why it's so helpful to have a professional in your corner to talk to. This podcast is sponsored by BetterHelp to provide our listeners with the opportunity to work with a licensed therapist from the comfort of your own home. Receive 10% off your first month when you sign up by going to betterhelp.com/TFL. That's betterhelp.com/T as in think, F as in fitness, L as in life. And remember, you're not alone. There are people out there who can help.
All right, welcome back to the Think Fitness Life podcast. Today we're going to dive into ankle sprains, what to do for them, how to treat them, how to approach them, because once you have sprained an ankle, that is going to stay with you for the rest of your life, but that doesn't mean the pain is going to stay for you. So we're going to talk about how to recover from that, how to deal with ankle sprains. We're also going to talk about how to manage neck pain / stiffness. And then, are kids' systems different than adults? How does the developing kid have a different system and a different growth pattern, different movement pattern than us adults? And how to train that and what to do with that. So without further ado, let's get into it. Here, so ankle sprains are very common in humans. Our ankles are designed to move around. They're designed to wobble. They're designed to feel the floor, to understand the ground. Now, we have created this world of concrete and solid floors that we need to walk on. So the ankle sometimes becomes more rigid than it used to. Well, years ago, when we're used to walking barefoot on dirt, gravel, forest, whatever, but that's changed, and our bodies need to adapt to the environment. So what happens? The ankle needs to adapt through it, and then we put these lovely things called shoes on our feet, which add comfort, add cushion as we're walking to and from on concrete or hard surfaces. This all plays a role. We can't avoid it. Yeah, there are some people that are going to say, hey, I'm going to go barefoot and walk around barefoot. I probably don't suggest that, because concrete and hard surfaces are going to destroy how our feet work. If you're out in nature, yeah, go walk barefoot on the grass, ground, all that stuff. Let your ankles wobble. But what happens when we get ankle sprains? Why does the ankle sprain? Why do the ankle sprains could be many different reasons. I've sprained my ankle many times, whether you're just playing in the backyard and you roll your ankle, whether your ankle rolls out or rolls in, you stress the ligaments and tendons and muscle at that joint. When that happens, you're often going to get an injury where it's called a ankle sprain, and it takes 4 to 6 weeks to heal from it. If you've ever had a high ankle sprain, which you sprain more higher up on the ankle, that might take a little bit longer to heal because you are actually tearing some of the tissues in that ankle site. And once that happens, you now go into the recovery phase of the body healing. Most of the time, they're going to put a bandage wrap around it. They will put you in a boot to allow those muscles to heal. Now, when you do allow those muscles to heal, or you're put in a boot, you're shielding that from stress. You are shielding it from tension being put on those tissue, which is fine. But with that, more scar tissue forms when you take tension off of that system, and it's going to heal. Now, this can be a problem because now you have scar tissue, which is more dense, fibrous tissue that's going to protect that joint from moving as much as it would because it was compromised and put in a position where it was overstretched or torn. So we get into this issue with, okay, if we do have an ankle sprain and we put it in a boot, how do we recover from it? Because we're going to create tissue that's not optimal for performance, for tension, for function, for range of motion. We need to restore that gradually as we go. Now, before we get into how to retrain the tissue, we're going to dive into what that ankle sprain means to the brain above it, because as we said, the ankle needs to move, it needs to wobble. There's a lot of attachments that go into the ankle from a muscle standpoint, from a joint standpoint. So we have the foot that attaches at that ankle, the talocrural joint, which is a very important joint because it attaches the fibula and the tibula with the talus of the foot. And it's a complex joint because it transfers rotation and movement from the foot up into the long bones of the fibula and tibula, into the knee, into the femur, and then into the hip. So it's transferring rotation up into the joints above that. And we need to have rotation to allow us to create forward locomotion, walking movements, side-to-side movements, any kind of movement possible. It's getting transferred through the floor, through the foot, up through the body. What connects our two bodies is our two floors underneath our feet. When we lose sense of stability on one or both feet, aka from an ankle sprain, the brain is going to adjust up the chain. Because we lose stability in the ankle for a time period, there has to be stability gained from somewhere else up the chain. So if you have a left ankle sprain, your right side of the body will understand what that left ankle is trying to do. It might take up more tension for that ankle sprain. That right shoulder might take more tension to help that left ankle. That left hip, left back might take more tension to help out because that ankle sprain. Any injury that we have in the past, our body's still going to recognize it because we changed some sort of tension at that tissue at some point in time. The brain is going to adapt from that. And once you have an ankle sprain, that history of the ankle sprain is going to stay with you for a while. Now, that doesn't mean it's going to plague you forever, but we need to train the ankle back appropriately to allow the sense of stability and groundedness through the joint, through the rotation needed through the whole chain, up to the knee, up to the hip, up to the rib cage, up to the brain, to understand how to be grounded and safe. And that's very important because most people, when they sprain an ankle, they let the ankle heal up, but they're not training the full system above. They're not reinforcing how to really reground themselves on one side or both sides, depending on the ankle that they sprained, or how they're going to adapt the tissue towards that. Because sometimes when people sprain their ankles become more prone to ankle sprains in the future because you've already stretched out and lengthened the tissues of that ankle. And that happens very often. I've sprained my right ankle a couple times, and I have a tendency to want to roll that ankle on. My ankle rolls from time to time. I don't get pain anywhere, but my joints and my ligaments on that ankle are more lax than my left. And through the adaptations of sports that I played, when I'm in a neutral position holding it, I can create an arch on the right. But if I let go and let gravity take away, my foot and ankle just collapse in. But I have a tendency to roll my ankle more to the out. I like to invert. I have inversion ankle sprains because of the position that my foot's in, depending on where I step or where my rotation above it is trying to go. So when looking at training for post ankle sprains, when we look at that, the first thing we want to really start to look at is, okay, if I'm not upright moving yet, what am I going to do? I'm going to do isometrics almost free. I'm going to do isometrics for probably from here on out. Like, this is going to be a staple to strengthening the muscles, the tendons, and the ligaments of that ankle. Mainly, we're going to look at the tendons of that joint. So we're putting the tension through isometrics, whether it's isometric pushes into a band where you're getting plantar flexion, isometric holds for 20, 30 seconds into a band or into a solid surface to start training tension to come back through the muscle and tendon joint, the muscle and tendon juncture into the tendon, then the tendon can affect the bone. This is where I'm going to start most people right off the bat, even when they are maybe still in the boot. If they can contract just a little bit and they have no pain, I'm going to have them do slight, maybe tencentric isometrics to start building back movement through that tissue. The worst thing, like I said earlier, is to allow that joint to have no tension on it and to allow it to atrophy. I've been in a boot before, not for an ankle sprain, but for a broken tib fib. And when you take that boot off and cast off, those muscles are significantly smaller because of the atrophy of the body. Like, it's unavoidable when you immobilize a joint, you are going to create a lot of atrophy through the joint, through the system. Now, if I knew back then about isometric training, I would have done that more often to keep tension throughout the system and allow those tendons to heal appropriately with the right fibers back, rather than creating more of a scar tissue collagenous cellular matrix, which is a lot stiffer and it's not as elastic as your natural tendon fibers would be if they healed back to what the fibers we wanted to be. Like post-training, if you aren't injured after training or after isometrics, your fibers, just like muscles, get broken down. We want to rebuild them up with fresh, brand new collagen. And when we get the cellular synthesis of new collagen, that's the kind of collagen we want to put down. If it's immobilized in a boot, we're not doing that as much, especially if we're not doing isometric exercises. And we can do isometric plantar flexion, isometric dorsiflexion exercises. And then as the boot gets off, that's the first thing I'm going to look at, is how to start to incorporate isometrics for maybe longer durations, 30, 40 seconds, then rest it and repeat 4 to 5 times to allow those tendons to understand tension first. Then once they start getting and progressing through that, then you can add more range of motion in and movement in to start training the tendons and the muscles at the same time. A lot of people, I think, forget about the tendons part of the tissue, and there's like, okay, I need to start getting back into training the muscle, which is fine. Muscle will adapt a little bit quicker. Muscle's going to adapt quicker than tendons just because of the blood flow. But we really want to stress, like, we want both to be strong at the same time because they're equally as important. And then we need to build on that sequence. Now, the next thing I want to go into is most of this stuff we're doing probably seated, slight standing, supported, hand on a wall, hand on a table, hand on a bench. If we're seated, that's fine. The end goal for ankle sprains is to get upright single leg activity in. This needs to coincide with function with the glutes, hamstrings, and quads to hold the system up, to feel safe, and to understand rotation from the whole system aspect standing on one leg that's transferred down through the ankle. And this is where a lot of times people go to PT and they're going to look solely at the ankle and get it strong, because that's the job of a physical therapist. They are going to look at the injured area and they are going to specifically work on that area because that's what they can bill for. That's what they can code for. But in PRI, as we look at the whole system, we have to understand that the ankle grounds us and connects the two floors, our left and right, together, connects our bodies together. But our system, our pelvis, our thorax, that keeps us centered and shifting and lateralized, and a sense of balance comes through more that midsection, that mid-core, through the pelvis and thorax. So we need to teach the ankle to work with the hips and with the thorax for rotation, with those femurs and tib fibs. Even if someone doesn't have ankle sprains or a history of ankle sprains, the upright techniques in PRI are geared towards creating that sense of stability through the ankle and the sense of degree of eversion, inversion, rotation. Where is that leg in a phase of forward locomotion? Is it in push-off? Is it in mid-stance? What is the correct timing for support of the system working together to understand that that ankle can wobble if the glutes, the hamstrings, the quads are all holding the system in a position at the right time and in the right position to allow that ankle to work. A good example of this would be something like shin splints. The reason we get shin splints is because the system above may be out of sequence and out of timing with the lower leg. So that foot hits the ground, that anterior tib needs to pull our tib fib forward to pull the system forward, femur forward, hips forward. If the hips are already positioned of an anteriorly rotated and the glutes and hamstrings can eccentrically control that lowering to the ground, that anterior tibialis can pull hard to get the body to go forward, creating a more stiff, rigid shin and ankle to hold that tight. Now, if you're doing that repetitively and you hit a position where that ankle is stiff and rigid and it rolls and that musculature of the ankle can't support that, or it's not allowed to wobble, you're going to create maybe a sprain or a strain on those muscles, on the tendons, on the ligaments of the joints, because of the sequencing is off through the system. So we're always looking at how can we create single leg stability with glutes, hamstrings, and quads all functioning together to build back sense of stability of the ground underneath. There's some great techniques in PRI. One of my favorites is the step through that teaches the body how to stand on one leg and go through the phases of forward locomotion. And when you do it, and when you see someone do it, you can actually see their ankle wobbling a little bit as it's going through the ranges of motion. And it's a subtle wobble because the person above feels anchored down through the floor because they have the sense of stance through glutes, hamstrings, adductors, abdominals on the hip above, on the side above, to allow that ankle to wobble and move. A stiff and rigid ankle is not a functioning ankle. That's going to go over well, because if that ankle is locked up, that means somewhere up the chain, that force of transfer is going to take more rotation or more unlocking because that joint is locked up and not moving. So if I lock the ankle up and I don't get enough eversion or inversion, where do you think that IR or ER is going to go? It could go to the knee, could go to the hip, could go to the rib cage, it could go up to the shoulder. The body's going to figure out how to move through space. So restoring upright activity with feet sensed on the floor coming up to the foot so you feel grounded, and then shifting that weight over to the ankle to train. That's the end goal when it comes to ankle sprains. Then as you get that, you get into more of the forward locomotion movement. You're getting back into running. You're getting back into jumping. So then that's where we start talking about more intensive or extensive, more extensive low-grade plyometrics at first. Pogo hops, small calf bounces, bounding, to see how that ankle is going to load. And just like any other progression, we're going to now train that ankle back into what its restorative function needs to be. Like, how do we get someone to be 100% where they were, even better before that ankle? Because that ankle sprain tells us that somewhere in the system, the force of a movement wasn't able to withstand, and the ankle took more of the force. Now, obviously, it can happen just, if not just rolling ankles, but doing something. If you're going to cut and your ankle rolls out or rolls in, it's just telling us where that force overloaded the system and where we might need to now strengthen that system. So yes, the next thing would be extensive plyometrics, small bouncing, bounding, hurdles, single leg, double leg. Then as you get stronger, we're also pairing this with strength training. We are pairing this with squatting, lunging, stuff to put the body through the full range. We are training the soleus, the gastrocs with different knee angles and ankle angles to train those different muscles. Knee bent, ankle more in plantar flex, dorsiflex, pushing through different ranges of motion. Then as you get better and better, you start adding intensive plyos, which are more of your box jumps, your double leg jumps, your single leg tuck jumps, your more bounding, your more forceful activities. At that point, we're starting to get back into full activity to really help that ankle. But it really becomes a sense of, when we're going into training every single day, you could be 3 years out post ankle sprain, or you could be 6 weeks out, is sensing the ability to understand how to shift your mass left and right, to lateralize yourself, and to feel grounded on one side of the body versus the other. Because most people, when they shift to one side or the other, they might not feel grounded, and that's where you create instability, and the body's going to try to create stability somewhere else, or even at that ankle again, if they don't have stability. So that is the big thing when ankle training, post ankle sprains, creating stability through the sense of your body, your brain, when shifting side to side in upright activities is the most important place to start. Then start getting into your daily routines. Neck stiffness and neck pain. This is a very, very common issue. When we do have neck pain, it's usually more geared towards upper traps, and this is what I'm really going to talk about when it comes to neck stiffness and neck pain. Levators, upper traps, they connect to the back of the cranium, the back of the skull where the occiput is, and then they attach down on the clavicle, the shoulder blade, the transverse process of the spine. What their objective is to hold the neck up and to allow the neck to move side to side, and also rotate, lift shoulder blades and clavicles. So when people come and when people ask, okay, what do you do for neck stiffness? First off, I'm going to think that someone has neck stiffness is that their system is more in an extension-based position. Their head is most likely going forward. The upper traps will kick in as the head goes forward, because those traps can be trying to hold the head back to align with the system. So if the head goes too far forward, like if you're over-exaggerating looking at a cell phone, those traps are trying to counterbalance that cranium from going too far forward, creating tightness. When the cranium goes too far forward, the traps are now going to battle the anterior neck muscles, because they're trying to pull the head forward for forward locomotion, for vision, for movement. The traps are now battling for balance, and they're going to become tense to try to pull us back into a position, or they're tense because they're in a position where they now can't move appropriately. They can't lift clavicles. They can't move the scapula, the shoulder blades up in the appropriate manner, because they're in a eccentric, a over lengthened but concentric, tightened position because of the cranium. So the first thing I'm going to look at is what is the position of the head and neck in the rib cage. Usually that's going to tell me that if someone has a tight neck, let's say posterior, anterior, that their breathing function and rib cage function is not working. And this will be looked at and restored through proper breathing mechanics with left zone of apposition, a left ab wall, or a right one if you're more of a bilateral, but I'm always going to start with that left ab wall to guide air into the upper chest, to allow the upper chest to expand with air, to allow the clavicles and scaps to expand and lift up appropriately when an inhale comes in, to see if we can decrease the tension that the upper traps are trying to do, also at the same time influencing the lordotic curve of the cervical spine. I'm trying to get that neck to be in a more curved state, to bring the cranium, the head back, to allow those traps to take tension off the system. If you're doing this simple, lie on your back, put a towel roll underneath your neck, and let your head rest on the mat or a floor behind you. Put your hands on your rib cage, exhale, bring your left rib and left sternum down, and hold that position. Nothing crazy, nothing tight. Take a breath in and feel your upper chest expand. You'll feel your upper traps lengthening in a good way. So eccentric length, but they're not holding you up against gravity because you're taking the tension off the system by restoring proper breathing mechanics. Now, the next thing we're going to look at when we're talking upper trap tightness is collarbones. Most people are going to think shoulder blades. Yeah, they're going to pull shoulder blades. Most people will have elevated, rounded shoulders. But a lot of people forget or don't know that the upper traps do influence and connect with the clavicles, and they will try to pull the clavicles up with assistance in breathing, creating more tightness if need be. But allowing those clavicles to openly move and rotate and lift and compress, that's a big thing. That's a key thing to allow air to come through the anterior chest, to allow those clavicles to move, so they're not anchored down and being opposed or being opposing the traps from doing what they want to do, which is to elevate those and the shoulder blades at the same time, because a lot of all this happens simultaneously. These traps are connected to many different attachment points. So when they lift up or you inhale and lift, they need to be working. After that, I'm going to look at, okay, what is the position of their shoulder blades? To decrease upper trap tension, I'm going to look at middle and low trap activation to teach the body how to pull those shoulder blades down and together and take tension off the upper traps from trying to hold shoulder blades up or try to hold arms up or try to get any movement possible through the arms, because the arms are connected, the traps are connected to the scaps, clavicles, which are connected to the glenohumeral joint, which is then humerus, arms, rotation. Just like we talked about with the ankle, it's all connected. So if the arms and hands are trying to get some sort of movement, rotation, upward lift, reach that they don't have, the upper traps might be trying to take over to do that the most. So a good thing to decrease upper trap tension and tone is, even if you're lying supine, pull your shoulder blades down and together, down towards your hips, squeeze them and sense them, feel the tension coming off your traps, because you're now taking away the ability for the upper traps to try to pull your shoulder blades up and try to pull forward. Now, if you still feel tightness as you do this, bring your cranium back, bring your head back. And then once your shoulder blades are down, slowly turn your head to one side and feel one side of your traps lengthening as the attachment points are being moved away from each other. You're going to allow them to inhibit and lengthen over time to feel that stretch, to decrease that tension. A lot of people, they get headaches because the levators and traps are too tight and they're too tense because shoulder blades are in wrong positions, or they don't have the strength of the low traps and middle traps, which, like your abs in front, they are your abs for your neck and your upper back. They will help pull you back in together. So a big thing we can talk about stretching next. And I don't really want to talk about the word stretching a lot because I don't really like it, because I think people just think, oh, I need to stretch it, it's going to go away. We need to reposition our body, reposition our sense of tension by using middle and low traps to re-tense and retrain those upper traps to stay off and not work and not be able to contract. So yes, you can stretch them. You can pull shoulder blades and shoulders away from necks and push the neck into the opposite position. But after that, you do need to retrain the muscles of between the shoulder blades to work. So if you do have questions on that, go check out my Instagram. There's a low trap post that I posted on how to get middle trap and low trap to help take tension away from your back, how to take tension away from your upper traps, your levators. Then as you start getting into more training realm, go check out the post. I posted one on overhead strength stability. You don't have to put this into weight and you don't have to overhead squat, but get a bar with a dowel behind your head and squeeze those shoulder blades down and together, and then train the upper traps to lift up and hold those positions. We can talk isometrics. Over time, you're going to feel tension between the low traps and middle traps in a good way. You'll feel those muscles holding you back in the right positions, thus decreasing tension throughout the whole body. All right. And lastly, I got a good question the other day from a client who asked, are kids' systems typically more neutral than adults? And then they create compensation as they develop. And then what age do you see kids start to have limited movement develop? Hips, shoulders, as an example. What sports play a role in this, and what creates bias and compensation patterns and accommodation patterns? This is a really good question because I really feel like I get this often, especially when talking in the posture restoration world of human evolution, human development. And development starts from a very, very young age. It starts when we're developing in the womb, and then it starts, as soon as we're born against gravity, we're trying to figure out how to manage gravity and pressure and walking and sitting and standing. And we go through these milestones of human development, motor patterns, neck reflexes. It all ingrains in us as we develop. Now, I'm not going to get into the stuff where we're really, really young, because those are just behavioral milestones that kids will develop. Some little bit later than the others, some earlier than others. It depends. Some siblings, if you have an older sibling, you might have picked up movement or behavior patterns a lot quicker because you saw your older sibling do that. That's very natural as well. But when it comes to younger kids, I always like to start about age around 7 or 8. And this really ties into when kids start to get their first kind of full set or full developed adult teeth, which create balance and stability of the system. Teeth are very important because they provide a floor for our cranium. And they are, as we're developing 4 or 5, we have our baby teeth, and then we're going to lose them and get our sets of adult teeth as we develop. And as we start 7, 8, starting to get our full set of adult teeth, that's when our system really starts to understand more balance, more stability, more sense of movement and timing and putting ourselves together. Think about when you were a kid, or if you go watch kids, a 4 or 5-year-old, their coordination's a little bit different than a 7, 8, 9-year-old. When you start to get and develop full sense of more movement patterns, more teeth, your options and stability, just like in the ankle, becomes more prevalent. So then you can function a little bit different. Now, we could also start talking about when the teeth develop. Yes, most of us go into braces, and when we start getting some orthodontia work, that changes our systems a little bit more, and 100% it does. It can auto-regulate. Orthodontia, and I don't want this to become a crazy orthodontia dental conversation, because it could, but just think our teeth in our mouth and our mandibles and maxillas all influence our cranium and how we move and how we sense it. And if those develop differently, that can affect how our systems run. And people with more higher palates sometimes have a higher autonomic nervous system. I'm one of them. I had a very high palate. My system was more compressed for function, for daily life. And that's just a strategy my body used to do it. You can still see it with some of my teeth on the bottom. Even though I've had braces a couple times, they still like to internally rotate because that's a movement strategy that I used over time. Now, big milestone is the development of teeth, but I don't really worry about that because I can't control the development of teeth in kids. I take that into effect, and I've seen it with some athletes when they, especially when the molars come in, they provide a really good sense of balance. We talk molars, we're going to talk calcaneus and heel sense and groundedness. So that's very important. But you see, as some kids lose teeth, that, they gain sense of teeth, they get braces. As they develop and grow as a human, they're getting more motor competency and more grounded and sense of stability and more sense of, as we're in the weight room moving, they're not as off balance and they can handle more complex movements or sequences, but it's all learning for them. It's how quick their brain can learn because we're giving them tasks to appreciate the learning process and do all this. Now, at the same time, these kids are performing sports. You put certain sports in their world, or certain dances, movements, whatever. It doesn't have to be exactly sports. It could be playing an instrument. The body's going to adapt from the positions you're putting them in. So even at a young age, if you start doing something at a young age, the body's going to accommodate to it. And it's not a bad thing that it accommodates to it, because if that's what someone likes to do, that's what they're going to want to do. And that's what their body's going to adapt to. And if you do it repetitively, yes, your body can create accommodation strategies and compensation strategies as you develop for a need to perform certain things, whether it's playing an instrument, whether it's playing ball, whether it's running, whether it's swimming, basketball, any sport, any art profession, or anything a kid does is going to affect how they develop. Like a good example is throwing. Young boys, they really know how to throw, or they learn how to throw. Some girls at a young age, they never learn how to throw. So as they get older, that motor pattern doesn't stick with them. And they never learn how to throw, and they develop poor motor qualities in that just because they never did it from a young age. Learning language from a young age is very simple. If you learn a couple languages, it's easier than when you're older, because our neurons are pruning and really grasping onto certain things that we're using at a young age. And that's what's going to stick with us. Now, when it comes to kids having limited movement, I don't really worry about it because I know that they're going to then change again. So a lot of people ask, oh, what do you think about doing a lot of these tests and measurements on younger kids for sports injury prevention or postural restoration or all this? And honestly, I don't really think that, we can do it. We can show you where you're at in a time frame, but kids are growing and ever developing that it can change so suddenly and so quick. But it's more or less to have them understand how to manage those changes. So it's good to have baseline, but in 3 months it could change, because now as we're starting to get into, we talked about 7 and 8, now we start to get into our preteens and teens. We have one of the biggest physiological events that happen to us, puberty. We start seeing, especially young females, they go through puberty earlier than males, then males go through puberty. That's the next biggest growth and development part of our lives and our life cycle. So it really comes down to what the body looks like after that. And then it's still growing. The human body will still grow. Some people are still growing till they're in their early 20s, male and female. So it's very tough to see, like, yes, people are going to present with limited ranges of motion. They are going to have compensatory patterns develop because of sports, because of their activity. The end goal is, that's all fine. How do we help them manage and balance that compensation pattern, balance those patterns that they develop through whatever modalities they pick? And that's where a lot of the PRI techniques come in handy. It's not just for adults. Adults, I think adult bodies are are easier to train when it comes to a lot of these posture restoration techniques than young kids for a couple reasons. One, adults have more proprioception. They have more sense of awareness of who they are, their body in space, how to manage pressure, how to manage tension, how to manage feelings. That's all there because we grew and developed. Younger kids, they're still learning that. They're still learning balance. They're still learning how to sense and manage pressure as their body's growing. Now, they can still get really efficient with it as you coach them, but adults will pick up cues a lot easier because they can now sense and feel different things. They can also understand more abstract concepts and more in-depth concepts because their brain's more fully developed. Kids, it's a little bit different, but it doesn't mean we don't do techniques with kids. We might cue them different. We might ask for different reference points. And over time, as we build, they get to learn those reference points. I don't like to overload, especially a younger kid who's maybe 7 to 11 right off the bat with so many different senses and cues. Sometimes they just need to get out and sense a couple things, run, jump, and perform some basic techniques before going into more in-depth sense of, I need to feel this on and this on. You can get it, but they might not really understand why they're feeling it or put together the system of why we're trying to get that. And that's okay. I'm not expecting them to. I expect them to care about the sports they want to play. If they want to go out and be a great soccer athlete, how do I give them optimal function and strength and speed and ability to move through space that they need? Limitations are going to occur. Everyone has them. Everyone's going to develop them. It only becomes an issue when there's pain involved. So a lot of athletes, they're going to have compensation patterns and patterns that we'll see. But if they don't have pain, I'm not really worried about it. I'll tell them what I see from a pattern standpoint, but I'm not going to say, hey, we need to avoid this pattern. We need to avoid this because that's not realistic. If you told me not to pitch a baseball when I was younger, I would have laughed at your face and gone and done it anyways because that's what I love to do and that's what I wanted to get good at. It's more giving that person the understanding of how to create strength to balance the system to be able to do what they do best and continue to do that for a long period of time. So kids, I would never say they're never really neutral. It's really hard when I say the word neutral. I really like to say it's not a static position of the body. It's the ability to pass through left side, right side, ability to go into positions, sense and feel certain things, and then go to the other side and do the exact same thing. So your system can stay balanced and move in this flow motion and not get into pain. Because a lot of times people, I think they understand that compensation is a bad word and they panic when they hear movement's going away. Well, you could have limited movement and still be a great performer. Just because you don't have 100% range of motion in a joint doesn't mean you're going to be a bad athlete. We just want you to understand when training the ability to move in and out of space and control and have that range of motion. Because if we don't control or have it and the brain doesn't sense it, it could get us into trouble long term. But going back to talking about puberty is once kids start to grow, their muscles, their tendons, everything's lengthening and bones, they grow at different rates. So their bodies has to accommodate differently to different portions in different things. So our goal as coaches is to help athletes understand why their bodies are changing from a tension standpoint. And that's the biggest thing I see, especially with runners when they're growing. It's the first question I ask once they come in with pain that all of a sudden stemmed out of nowhere. There wasn't an acute injury. Did you grow in the last 6 months? Because the body is now relearning a whole new organism. If you grew half an inch to an inch, your center of mass needs to be relearned of where it is. Your foot grounding on left and right needs to relearn where it is. The length tension relationship of tissues in the body need to relearn how to hold you up and adapt to a system that's ever changing, but also needs to have the demands every single day to go to school, to walk, to get on the bus, to play sports. No human's ever really neutral 100% every single day. We're developing as we go throughout our world, and how we develop as kids and what sports we play all lead up to how we develop. And that's the fun part about it. One of the coolest things I show people is I'm very, very right side dominant. And I've mentioned this in other podcasts. Like, I am right side lateralized to the extreme. I was a right-handed pitcher. I loved pushing off the inside of the pitching mound, the rubber, to create force and tension to throw a ball really fast. So what does my body look like? How did it adapt? Well, to get more torque and internal rotation, I had to internally rotate and collapse my right foot. My right ankle needed to collapse down and in to leverage how I put my foot on the baseball mound. And I angled it off of it and wedged my foot into the side of the ground and into the rubber to create leverage. Now I show people examples of what my foot looks like in neutral versus what it looks like collapsed. My tib, fib, and my femur also followed in that line. Now, what I did when I was younger, and I played baseball for a long time, it affects me now when I'm going into forward locomotive motion and very much when I'm running. I can feel it because my foot on the right wants to collapse. So it wants to stay in mid stance and stay heavy on the right side, aka that drives more knee problems if I don't train my body to have sense of glutes in push off and external rotation and training that phase of my right leg. So I really focus on using what I know from my patterns and training the opposite of it to allow me to be good at things that I'm trying to do as an adult, because I don't play sports anymore. But it also reflects back and it makes me think about how it limited me in other certain sports that I played in development. And I wish I knew what I knew now back then, because I could train it differently. And that's really what this podcast is about, and what I do as a coach, training youth athletes and younger kids, is to understand that how to manage their patterns that a sport or a instrument or their life creates, to allow them to still do that effectively, play other sports and manage it, and not create further patterns. Now, another fun part about what I do is people who have gone to really high levels of what they want to do. I've worked with people in ballet, high level sports, whether it's musicians or just your average population that were really good at something that they did consistently. Their body will show me what they did, and it's fun to work getting them back to feeling good and feeling like they can move without being stuck, without over tensing, and without limitations, because that's really what we want our system to do. So a good example of that is working with a lot of figure skaters especially, let's talk about people who do dance and ballet. They have to create a more hypermobile strategy, or they already had that strategy to be able to get into these positions. Now, as an athlete, I'm managing how to keep them on the ice, how to keep them performing and do this. But when they're done playing sport, that's the biggest thing, because their body doesn't need that demand anymore because they've stopped playing sport. How do you get them to resense and retrain tension and pattern and how to use that? That's one of the goals, incorporating strength training and the use of PRI techniques to help people have optimal function and optimal quality of life. So to wrap up, I don't worry about kids being neutral and having limitations, because it's a good area to look at, and limitations just are what we do. It's what we develop managing gravity and managing our life. Everyone's going to have different limitations, but it's never a bad thing. It's just how we develop, and allowing someone to be coached through and having someone be able to understand their limitations and how to work through their limitations to get them to be unlimited in range of motion or to restore what they need for optimal function and feeling. That's the end goal. So if you do have any questions, please feel free to reach out to us on Instagram, Think Fitness Life. On Instagram, you can find me at eric.menchie.prt. You can check out some of those techniques I mentioned, low traps. You can check out some lifting videos. You can check out how I incorporate my posture restoration training into my strength training. You can find us at thinkfitnesslife.com. If you do have questions, email us at thinkfitnesslife, because we love to hear these questions from clients. We love answering these on the podcast and talking about topics that, whether you're a kid listening to this or you're an adult that has kids, how to navigate and how to help out posture, position, injuries. So until next time.
Matt Gluckman and Eric Menchie here from Think Fitness Life. Our entire careers have been dedicated to fitness, particularly how the mind helps the body. We've been around gyms and nutrition strategies for 25 plus years collectively, and nothing harms or helps better than your own mind, untrained or trained. Pushing beyond your limits, overcoming whatever's thrown your way, and making the decision to show up day in and day out as a lifestyle takes more soul than sand. And what I mean by that is when you can get your mindset and heart leading you consistently in the direction of your goals and dreams, well, it's just a matter of time before you have the performance, physique, or quality of life you're yearning for. See, your thoughts will stem from your beliefs, which will then lead you to action, which develop into your behavior and ultimately lead you to results. It's really that simple. Our process takes time and it takes open communication. It's amazing what pops up along the fitness journey to betterment, and we can be there every step of the way. To learn more or apply for coaching, visit www.thinkfitnesslife.com. Start recreating your life today.
Marketing is hard. But I'll tell you a little secret. It doesn't have to be. Let me point something out. You're listening to a podcast right now, and it's great. You love the host. You seek it out and download it. You listen to it while driving, working out, cooking, even going to the bathroom. Podcasts are a pretty close companion. And this is a podcast ad. Did I get your attention? You can reach great listeners like yourself with podcast advertising from Libsyn Ads. Choose from hundreds of top podcasts offering host endorsements, or run a pre-produced ad like this one across thousands of shows to reach your target audience in their favorite podcasts with Libsyn Ads. Go to libsynads.com, that's Libsyn ads.com today